Welcome, everyone, to Healthcare 2040, a series that Matter produces in collaboration with Hillrom. I am Stephen Collins, the CEO of Matter. We're a healthcare technology incubator and innovation hub built on a belief that collaboration between entrepreneurs and industry leaders is the best way to develop healthcare solutions. Today's program is part of our Healthcare 2040 series, where we look at what healthcare might look like in 20 years and how we're going to get there. We have a terrific collaboration with Hillrom to produce this series. Hillrom is a Chicago-based company that's evolved from beds way back when to offering a broad suite of solutions, focusing on connected care and earlier diagnosis, workflow management, and a variety of other tech-enabled healthcare innovations. Today's conversation will explore the role of voice technology in innovative care models. And so who better to talk with than Alexa? Amazon's share of the smart speaker market is something like 70%, and somewhere on the order of 50 million households in the US seem to have one. So to help us understand the role of voice in healthcare and the direction we're heading on our path towards 2040, I'm delighted to introduce Amanda Goltz, Alexa's Health and Wellness Business Development Lead. Her background includes stints with Aetna, BTG, and Partners Healthcare. Moderating the conversation today is Carlos Uria, the Global Vice President of Medical Affairs and Informatics at Hillrom. He provides medical oversight for evidence generation and dissemination activities and offers guidance in product development and pipeline strategy for the company. Amanda's going to kick things off, and then Carlos will join to moderate a conversation. So Amanda, thank you so much for joining us. We are really looking forward to your comments.
Thanks so much, Stephen, for that great introduction. And I'm very, very happy to be here. Thank you to Hillrom and to Matter for having me. As announced, I am indeed Amanda Goltz. I lead business development for Alexa Health and Wellness at Amazon. I'm here to tell you all about what that is and our hopes and dreams for voice technology transforming healthcare, how you can get involved and build the healthcare experiences that patients and clinicians want on our platform. And then we're going to take some hopefully provocative and exciting questions from Carlos at the midpoint of the talk. So welcome, everyone. I'm going to launch right into it. As you probably know, and hopefully you have one in your home, Alexa is the friendly, convenient, helpful voice AI that lives in the Echo family of devices, both the Pringles can and the new devices that have a screen and a camera. That screen is also a touch screen, so the experiences are both audio and visual. Our latest in the Echo line is the Echo Show 10, which has a screen that follows you. It follows the sound of your voice, so it doesn't watch you, it listens to you, and it rotates helpfully to display the information that you asked for wherever you are in the room. I was playing around with mine one day and I said to it, just jokingly, not expecting any response whatsoever, Alexa, look away. And the screen spun around so quickly that it knocked everything off my desk. So someone programmed it to obey that exact command. So that fulfills our desire that Alexa is indeed responsive to everything you want, even if it's don't look at me. We also put the Alexa intelligence and personality in several third-party hardware implementations, not just soundbars and smart home devices, but also on the go, exterior to your home locations, like late model Acura and Buicks, wearable earbuds, wearable eyeglass frames, a loop that goes around your finger that you can speak into, and several other, not necessarily hardware that's made by Amazon, but anything that meets our requirements for a far-field microphone and speakers. Alexa is the same everywhere, whether you're using your Fire Kindle, your Fire TV, a third-party device, or an Echo, it is the same exact experience and the same exact set of capabilities. If you would like to refill your medications from your Fire TV, you can do that. If you would like to order a pizza on your way home from your car, you can do that. So that is also part of our obsession with customer delight, that Alexa does exactly what you expect her to, no matter where she is. We're going to get to this a little bit later when we talk about the ramifications of voice assistants and what they might be teaching us at the same time we're teaching them. You will notice that Alexa is female and her voice identifies as female. You can say today to your Alexa device, Alexa, change your voice, and she will transform into a male voice. That male voice is also called Alexa, but the voice that issues forth from the device is male. So we've sort of mitigated that one piece where we were having a stereotypical female assistant, and now we have a male voice, and we can talk much more about what it means to have voice assistants gendered one way or another and how we interact with them in a little bit. But some more about Alexa. Alexa has many domains: shopping, games, entertainment, books. What else can you do? Many things. Home health organization, not home health, sorry, home household organization. Not everything is healthcare, although I would like it to be. Alexa can order you groceries. She can walk you through recipes. She can call your family in for dinner. She can organize people's school schedules and homework and pickups. She can reorder anything you like from Amazon.com, of course, but also many other stores. She can tell you when your groceries are arriving, and she can coordinate your calendar, email, and daily schedule. Those all fall in the assistant category. What my domain is known for, health and wellness, is our Hipaa eligibility. All of you know what that means, so I won't go down the road into Hipaa, although I will talk about our framework a little later on. But what that means is we can handle protected health information as defined by the regulation in our skills. So today, millions of people are using Alexa to refill their medications, retrieve their last lab result from their patient portal, make an appointment with their physician, find the nearest urgent care center, access their daily care plan or their post-discharge plan after they're sent home from the hospital, and many other daily healthcare tasks. We also have a division that deploys Alexa devices in hospitals and clinics and clinical settings. Now, that's a lot less mature than our consumer deployments in the home. And that's because the legacy of Alexa, she's 6 years old, is as a consumer object in the home that individuals buy off of Amazon.com. To take that consumer device and make it suitable for enterprise implies a lot of extra bells and whistles, features and services, if you will, that we need to develop while remediating something that was developed on a technology platform for a consumer device. Our first forays into that were in enterprise and hospitality a few years ago, where you can place Alexa-enabled devices in corporate settings, walk into a meeting room and say, Alexa, start my meeting. And she brings in the teleconference system, invites all your scheduled attendees, looks at your calendar to see who should be there and who you are, recognizes your voice, and moderates the meeting. We also had hospitality. If you've ever been to a hotel room in which there was an Alexa device that you could ask questions like, order room service, get me more towels, ask the concierge for tickets to a show tonight. So we evolved that into clinical settings. And then COVID-19 happened. And that accelerated our development of Alexa in enterprise settings, like lighting fuel on a fire, because we really wanted to be helpful and help overburden frontline healthcare workers protect themselves and yet be able to respond to the urgent pandemic need. What we did is we put Echo devices with Alexa into hospitals. We put one in the patient room on the isolation ward for COVID, and we in each patient room, and then we put one single device at the nurse's station. The patient can call the nurse using the call button, usually on their Hillrom bed, and the nurse can respond through the Echo device. The nurse can see and speak with the patient, and he does not have to put on PPE or go into the room and risk infection in order to do that. So this was something we deployed really quickly under an emergency Hipaa waiver guidance, because we're still working on Hipaa eligibility in the enterprise. We have it in consumer. We're still working on it for clinical settings when we have managed devices owned not by the patient, but by the enterprise organization itself. And we have about a couple hundred hospitals in that program that told us that it saved them on PPE costs. It really helped the frontline workers do their jobs. It helped give access to patients who otherwise could not have someone come in the room. And it also, we handed out tablets that connected the patient with their family in the really dark months where family members and loved ones could not visit their loved patient in the hospital. So we're building on that. we're going back, remediating our tech debt, figuring out what the right use cases are for a clinician. There are so many of them. There are use cases for a patient in a clinical setting. There are use cases for the ordering physician. There are use cases for the assisting medical staff. So we are figuring all that out, and we would love and welcome all of your ideas. So what are people using Alexa for now, and who are we working with? Capabilities on Alexa are called skills. We have two types of skills. We have native first-party skills, and we have third-party skills. The difference sounds complicated, but it's really not. If you say to Alexa, Alexa, what's the weather? She'll tell you. But Alexa decides what the source of that weather data is, and she decides the interaction model, what questions you can then ask in the ensuing conversation. Alexa, what's the weather? According to the local weather station, your weather is going to be, it's always the same in San Francisco, so this is an easy one for me to answer. It's going to be 59 and foggy today with high winds in the afternoon. And then you can say to Alexa, what's it going to be like tomorrow? And she'll tell you. If you say instead, that's a first party native experience. If you say instead, Alexa, ask the weather channel what the weather is going to be. Alexa lights up her backend APIs, which are connected directly to the weather channel. The call retrieves the weather data from the weather channel, and the weather channel answers you through Alexa, saying the weather will be, again, 59 and foggy, San Francisco. And the interaction model, the ensuing conversations that you can have, are determined by the weather channel, not by Alexa. The data is not stored, it's processed by the Alexa cloud service. Weather channel owns and operates that skill. This is exactly what we do when we build skills with hospitals and home health agencies to help patients with their care plan at home. We have a skill with Christiana Care, a big integrated delivery network in the Delmarva. For those of you who are not from where I am from, that is the Delaware, Maryland, Virginia tri-state area, famous for where President Biden got his COVID shots. Christiana Care has about 250,000 fragile seniors living at home who don't want to come into the hospital for care during COVID. So they built a comprehensive skill on Alexa that helps each of those individual seniors access their care plan from Alexa simply by saying, Alexa, ask home health coach what I'm supposed to do today. Every day the skill changes dynamically based on what the information in the EHR says about that patient's instructions for their care plan. If medications have changed, if dosing has changed, if timing has changed, physical therapy and occupational therapy exercises, visits from the home nurse or the home care aide, all of those are included, wound care checks. And Alexa will light herself up at certain times of the day and say, now it's time for your 10 a.m. medications. That's lisanapril and simvastatin. Are you taking them? And you respond. 4 p.m. It's time for your PT exercises. I'll walk you through them. And the screen displays follow me instructions on how to do your calf raises and your stand-ups. If the senior, as we all have these moments, says to Alexa, I don't feel like it. I don't want to do that. Stop nagging me. Alexa will respond with a goal that the senior set with their home care nurse at the beginning of their journey with Alexa. You want to walk your granddaughter down the aisle at her wedding in December. You want to visit California with your wife in May. You want to be able to play tennis again. And Alexa will remind the senior that that's their health goal and that taking their medications or doing their exercises will help get them there as a kind of behavioral change motivation. We are doing research right now with Christiana Care to figure out whether we made measurable, statistically valid improvements in the patient activation measure, which is the gold standard patient-reported outcome, clinical validated measure of adherence to care plan and empowerment of the patient to follow their own medical instructions. And so we look very much forward to releasing those results next month. And for those of you who are going to the health conference in October, please join us there, where we'll be hosting a session with Christiana Care on that. Now, that's a very mature, well-developed, ongoing skill with lots of tubes into the clinical systems at Christiana Care that power the information in that skill. We have much lighter weight opportunities as well. We have integration with pharmacies to retrieve your daily dispense list and remind you to take your medications and refill them simply by saying, Alexa, refill my meds. You don't have to have the pill bottle with you. If you've linked with your pharmacy and Alexa recognizes your voice, she knows which meds you're on and she knows it's you. If you want to make an appointment, easy. If you want to find the COVID vaccine, also easy. If you want to ask Alexa information on what a med is for, or how to anticipate the experience of being on certain therapies, she can tell you. And we are developing new skills all the time. We partner primarily with hospitals, health systems, pharmacies, pharmacy benefits managers, insurance plans, and of course, individual provider groups and life sciences companies to make sure that the information that we're providing is accurate, reliable, and up to date. Why do we go organization by organization? Why is our emphasis on third-party skills? Well, if Alexa doesn't partner with healthcare organizations, because she's never going to be a doctor, it's never going to be Dr. Alexa. She's never going to treat you. She's never going to diagnose you, because I don't want to go down that FDA regulatory pathway. Watch me eat those words in 2 years when we do that. But right now we have no plans to get FDA certification. So she's not meant to diagnose. She's meant to help you find the right next step on your healthcare journey and help you navigate both the financial side and the clinical side of what you're dealing with for your health and for your family's health. So why not just load all the information on Alexa? Well, it's important for the patient to know that it's their data, right? This is my hospital speaking to me through Alexa. This is my health plan telling me my claim status. This is my pharmacy telling me what meds I'm on. Second, so there's that trust element up front first. Second, if we just loaded a ton of generic health information on Alexa, it's really just a generic search. It's not your information tailored to who you are and your diagnosis. That said, there are limits. We don't use the data we have access to in health skills to target any user, even for recommendations on other health skills or experiences that would be helpful to them. We just don't do it. The risk of offending a customer, which is the biggest sin at Amazon, is just too high. We don't use it, God forbid, to target anybody based on products on Amazon.com. That's an explicit promise that we make contractually in our Hipaa BAA. I think that there is some room to think about these rules in a thoughtful way in the future. When might it be helpful to recommend another health experience? When might a prompt for the next step really matter? When might a hint save somebody's life? So we're thinking about how to do that in a really thoughtful way. And we're also thinking about how consumers manage their own health data and how they might opt in to those experiences. What I'm thinking about specifically is if I'm using a skill, we have one available from several companies, including Livongo, on managing my diabetes, where I'm working with a remote coach who has access to my blood sugar values based on my wireless glucometer. And I'm very happy with Alexa's prompts on when I should dose insulin and when I should eat and how I feel better. And I would like to be notified by Alexa when there's a clinical trial that might benefit me that I can do either virtually or within 30 miles. Could I opt in to have her tell me that? And would it be okay for Alexa to say, there's a clinical trial near you based on the conditions you told me you had? So we're thinking about these use cases really, really carefully. It gets a whole other level of difficulty when we go into the clinical setting. So a lot of the basic rules about how Alexa works, the wake word, for example, which can be customized to Alexa, computer, Echo, or Amazon. Do we really want clinicians in the clinical setting constantly saying, hey, Alexa, or hey, Echo, or hey, Amazon, or should they just speak and have Alexa know they're talking in an ambient way? There's a big privacy ramification to that. The reason she has a wake word is because she's not always listening, contrary to some common myths. She is buffering on the device for a fraction of a second for her wake word. She does not hear it. She does not send data to the cloud. If she hears her wake word, she starts spinning her blue light or putting her blue light on the bottom of the display screen, and that's when you know that she is sending data to the cloud. You can also delete all data that you have told Alexa simply by saying, Alexa, delete what I said today, this week, last month, ever, and she'll delete it. And she'll delete it off of all of the locations in the Amazon voice service and the Alexa specific data repositories. So what does getting rid of the wake word mean for that infrastructure? That's what we're thinking through. We also think about third-party versus first-party invocations. If I'm working with my own clinical systems through Alexa, it's really important that I access those systems by validating my identity. But we don't want a doctor to have to go through voice profile every single time they utter something to Alexa. So what are some smart ways we could do that? Potentially by integrating with badging systems or other authentication systems in the hospital. And how could our friends at AWS help with that with login with Amazon? we're trying to move as fast as we can to help frontline healthcare workers. We don't require use of the Amazon suite of services. We welcome integrations at all levels in the Alexa ecosystem, but we do want to bring to bear whatever we can to make that experience seamless, easy, and delightful, even in a healthcare setting where you're worried, scared, and don't know what to do next, where it's even more important. So with that, I will invite you all to build skills on Alexa. Third-party skills are available to you via the Alexa Developer Console. You simply sign up online, go through a regular standard app store agreement like you would see anywhere else. Our natural language understanding and machine learning algorithms are tooling is there and available for your use. We have a really simple GUI for putting a skill together by matching slots and intents and creating conversation. We have tons of storyboards, tutorials, help, a list of agencies who can help you build skills that are delightful, have multi-conversational terms that help you collect the data that you want to collect and help deliver the experience to your customers, patients, members, clinicians that you want to. And it's all there and it's all free. No cost to build a skill. So I invite you to sign up at developer.amazon.com and navigate to Alexa Skills and build a skill. And I am always available to help. So with that, I'll conclude my remarks. I think everybody's sick of listening to me, and I'm excited to get to your questions about the future of voice and pivot away from Alexa specifically and a little bit more to what voice can do for us. So I invite Carlos to join me.
Hi, Amanda. Thank you so much. And hello, everybody in the audience. Thank you so much for those opening remarks, Amanda. I can tell you lots and lots of questions about Alexa, so we'll figure out how we're going to get through that. But you know what, maybe the way I'm going to start, and it connects a little bit with your most recent statement about inviting those people and those developers when you think about skills. So maybe bring the conversation up as we think about voice at a higher level. And knowing that our audience, a lot of startups and innovation, what should people be thinking in terms of voice when they're thinking about a strategy around voice? What will be your recommendation? What will be your advice for those developers in the audience?
Absolutely. Great question. And here's where I can share some of my hard-earned knowledge. I've been with Alexa Health since the beginning when we got Hipaa in 2019 and the lead up to that. And so we've learned a lot about what makes a good skill that has people coming back every day to engage with that experience on Alexa, and what makes a not so good skill that people get frustrated with and abandon and leave us really bad reviews on Amazon.com about. So the first thing I'll begin with a caution. I think our natural instinct is to voiceify our existing experiences, to take what we already offer for engagement with our customers in an app or a website and just create a voice equivalent. Unfortunately, it's not that easy. The interaction is completely different. Navigation through a website or an app is very linear, next page, next page, next page, or select from the following options. But the options are visual and you sort of know where to go next. Not so on voice. Alexa can prompt you. Some things you can ask me are, here's what you should do next. But that's not a great conversation. That's being told what to do constantly, right? That turns you into the robot and Alexa into the leader, and we want it to be the other way around. So how do we do that? The first is start with a good voice use case. The best voice use case is something hands-free. That's when I really want to use Alexa, right? Or any voice assistant. When I don't need to go on an app on my phone, I don't need to get my teenager off the computer so I can use it for 5 minutes. It's really about something that I would like to listen to while I'm using my hands for something else. In the world of Alexa, the ideal one is a recipe. I'm following a recipe. She's prompting me what to do. She's showing me how to chop an onion. She's showing me what the oven settings should look like. The equivalent in healthcare is a skill that we have from Boston Children's Hospital. So Boston Children's created a skill called My Daily Check-In. And if you have a child who's recovering from a cardiac surgery, Alexa will tell you every day for 2 weeks exactly what you should do for your kid that day. Ideal hands-free. You're dealing with a squirming kid and you're trying to check the incision site to make sure it's clean and white, not red and puffy. Trying to take your kid's temperature, make sure it's not elevated from a post-surgical infection. You're trying to do various assessments of the skill of the kid's alertness and mobility that the skill is prompting you to do. And then you're also talking to Alexa. Oh, I don't know, he seems kind of sleepy and he didn't really eat today. Like, is that a problem? Should I call my doctor? And then the skill responds to you. You don't have to sort of deal with multiple things like typing on a computer while you're holding a baby, while you're also reading, while you're also trying to figure out what's going on with the baby. So voice hands-free experiences, Fantastic place to start with Alexa. The other is really simple tasks where if you think through the experience, it's much quicker to do it by voice than by app. A lot of things, unfortunately, are easier to do by app, frankly. Take patient-reported outcomes. Take the SF-12, the functional patient-reported outcome measure of standard function, or the PHQ-9, the 30-question survey on depression. Really annoying to do on Alexa. She's going to ask you the same 30 questions every single day for 6 months. You are going to get so sick of hearing those questions, and you can't go faster. You can't anticipate the question and say 6, go to the next one. She's not going to do that. That's easier to do on an app. What's easier to do on Alexa than an app is refill your meds. Why do I want to call the pharmacy? Why do I even want to open the pharmacy app? Just say, Alexa, refill my meds. She's like, hi, Amanda. Okay, I'll refill your 2 meds today. Is that what you want? Yes, done. Then she tells me when to pick them up or when they're being mailed to me. That's a good use case. Super convenient to do by voice. I can do it while I'm doing something else, right? So number 1 is the use case. Number 2 is it a new way to offer a service to your customers? If most of the things that you already do on your app are probably better done on an app, what's a new thing you could do by voice? Could you show them a cool video on your product? Could you connect them with a social community that would really help? Could you offer them connections to other products and services that would help in their healthcare journey that they can just buy with, we used to say 1 click, but now we just say with 1 word. So that's another way to think through it. And then the third piece of advice on good skills is they need to change frequently, way more frequently than your app or your website does, because Alexa needs to be fresh and new. The way we often do this in health skills is we have a health fact of the day or a health tip of the day. I tend to rely on my partners, because if I were in charge of this, the facts would be really weird and off-putting because I'm a huge healthcare nerd. It would be things like the first surgery was done completely without anesthesia. Yeah, nobody wants to hear that. But our partners often come up with great advice, like ask your doctor if you need a vitamin D supplement. Most people living above the 37th parallel don't get enough sunlight. And that's useful information I can actually use, much more so than the surgery without anesthetic. So that's my advice for a good skill.
Awesome. Amanda, one of the things that I'm curious about, I've seen a couple of questions come up around, the lack of humanity of voice and artificial intelligence in general. That also came up last week when we talked about it with our other guests. What is your take around empathy, and what does it mean to interact with voice or through voice, and the role that it plays in terms of humanizing or dehumanizing the healthcare interaction?
Yeah, that's a fantastic point. Some of it branches off from what I mentioned before about we don't want Alexa to be your doctor. We never want her to contradict what you've actually heard in terms of clinical advice. We want to augment a caregiver relationship, not supplant it. So we put firm guardrails around what she does and does not do in health. What we have found, and this is really interesting, is that a lot of users of Alexa tell us that it's actually way more personal, intimate, and welcoming than other social communities, either online or in social media or other experiences. There's something about this one-on-one conversation that you're having with your Alexa device that other people can't listen to, unlike a Facebook post or a blog or a website that seems very private and very confidential. That ability to delete everything you said to Alexa certainly helps that. And the strong guardrails we put around who can see your data and how it's stored. It's not stored in a third-party skill. We don't hold on to it. And who can access your data and for what purpose also helps with that. Now, often this will alert us to very, very serious, what I would frankly call defects on Alexa that we have to fix. In COVID, we found we monitor these very carefully because we try to see where Alexa is failing to answer somebody. So we check the logs of what people are saying to Alexa and what those highest frequency utterances are, where Alexa does something called the fallback intent. She says, I don't know about that. If significant numbers of people are asking her something and she's not responding with an answer, we want to fix that really quick. So we found in COVID that people were saying to Alexa, I'm sad, I'm anxious, I'm depressed, I'm afraid. Unfortunately, in the beginning, because this took us by surprise, the response was a defect. It was not a good one. Alexa would be like, I often go for a walk, or I like rainbows, whatever. It was terrible. So we acted really quickly to fix that. And what we did is we stood up an experience where she offers you a meditation exercise, a guided meditation, tips from a therapist from our third-party behavioral health, cognitive behavioral therapy partner Talkspace. Or if you are in crisis, she asks you, do you just really need to talk to somebody now? And you say yes, the device itself will start ringing like a phone, and you'll be connected to the National Suicide Prevention Hotline. You don't have to write a number down. You don't have to do anything. All you have to do is say yes, and we will connect you. Now, that's a down payment on a much richer experience that we are thinking about in mental health. I think we can do better. But that was the initial response. The fact that people were turning to Alexa and saying that signaled to us that they, maybe they were just playing around, maybe they were just seeing what would happen, maybe they were desperate. But I think a lot of people actually expected her to have an answer. I think they have a relationship with her. I think they see her as a source of help. Same with all voice assistants. And the burden is on us to provide that help in a secure and convenient way. So I see it as a much different modality than some of those public space or online civic polis where you're performing in front of everybody. It feels much more one-to-one. Other questions that I get in that same vein are around how we make Alexa accessible to everybody. What if you can't speak? What if you have a speech impediment? What if you are visually impaired? What if you're really bad at tech? What if you're very distrustful of Amazon? We're not going to force anybody to use our products. I'm sure other voice assistants feel the same, but we do work really hard on accessibility. We have an entire team called Alexa for Everyone, or Everybody, I'm sorry, that focuses on exactly this. We made a significant investment in a company called VoiceIt, which adjusts voice technologies to listen to people accurately who have divergent speech patterns, speech impediments, and other issues. We have 6 speeds on Alexa. She can slow down 3 levels. She can also speed up 3 levels because people with visual problems respond and interpret information auditorially much faster than the rest of us do. So let's make their interactions much more efficient. And then we work on the Alexa personality and how she interacts with people who respond to personalities differently. And we pay a lot of attention to all of that to try to make sure that it's the experience that you expect, no matter what your individual expectations are, and that she is truly accessible to everybody. So that's what we focus on there to build that personal connection.
So Amanda, lots of good examples about potential use of voice and Alexa in particular. Getting the crystal ball out, and looking, healthcare 2040, which is sort of like the purpose of the series. And, if you think about it, 20 years that far down the line is not that much, but where do you see being sort of like the role of voice in the future healthcare delivery models?
Absolutely. So this is my favorite part where I get to speculate on the future. None of my remarks should be taken as indicative of Amazon's future investments. This is Amanda speaking, not reflective of any of our product roadmaps or visions. These are things I would love to see as an Alexa customer. And in 2040, I expect to be highly dependent on Alexa for my healthcare tasks. So this matters to me a lot. So I see 3 stages of voice when we look in 2040, when we think about where we are now and where we need to be then. One is we need to make it a lot more ambient. We really need to focus on the ambient voice experience and the ambient computing aspects of it. We think about, and this was the original inspiration for Alexa, the Star Trek computer. Remember in all of the Star Treks, but in the original series, the computer just magically knew when you were talking to it as opposed to somebody else. Yeah. Like sometimes they used the wake word, which was computer, but often they just shouted a command, what's the engine power? And the computer would just know. We need to make Alexa like that while still preserving our commitments to privacy and when we're actually sending data to Amazon and when we're not. So making it a lot less, wake word, account link, voice profile. Okay, now I'm in the experience, but still keeping those privacy guardrails up. That's where we really need to go. She should anticipate your needs, not be so passive that you have to give her very elaborate instructions. Phase 2 is we need to increase what I would call discovery of experiences on Alexa. Everybody knows that you can ask her the time or set an alarm or turn on your lights. No one knows that she can refill your medications, even though we've invested a lot of marketing and firepower to that. There's a couple of reasons there. One is the way people find experiences on Alexa is they experiment. Hey, Alexa, can you order me a pizza? Can you get me an Uber? Can you show me a movie? And then you're like, wow, that really worked. I'm going to try more. No one, with the possible exception of me, sits at home on Saturday night and is like, Alexa, can you track my immunization history? So how do we make either those experiences organically discoverable so that if you say, Alexa, do I need a doctor? She can respond to you and usher you into other third-party experiences that are appropriate for you. Or we need to make her anticipatory, where she uses the information from your other interactions on Alexa to suggest experiences you can have, again, without ever offending somebody. The worst case scenario is you order 20 donuts on Amazon Fresh, and the next second Alexa's like, hey, do you have diabetes? No, we do not want that. So we're going to have to figure out a way to guide people in a way that's not offensive and get them to discover health experiences on Alexa so they use her that way. Stage 3 is business to business. And this is a lot more complicated than it sounds. If Alexa's your brain, she keeps track of things for you, she helps you do tasks, she organizes your family. Imagine how much bigger that gets when she's a assistant to the house staff at a hospital, managing a ward of 40 patients, or the chief nursing officer, keeping an eye on quality and safety throughout an entire 10 hospital system. Think of the systems that Alexa's going to have to integrate with. Pyxis for drugs, radiology for imaging, the ordering system, the clinical decision-making system, obviously the EHR, incorporating all of those pieces, registration and scheduling, staffing, who's in what room. And so we're going to have to think about really good ways to do all of that that don't involve building endless new linkages. We're going to have to do that at scale, right? So we have the same problem that healthcare does. We have to struggle with legacy systems, but we have to put them into the AI so that the AI can be useful. Once we achieve all those 3 phases, I think that's what 2040 looks like, where voice is as natural as speaking, just like it is now, but Alexa retrieves exactly the result you were looking for.
Okay, perfect. Amanda, maybe moving a little bit into a different area, more generically around disparities in healthcare. It's a topic that is very interesting. We have a couple of questions here around, do you think voice will have a role in helping address disparities in healthcare?
I think we have a long way to go on that one. I think our emphasis on the customer and working back from the customer is going to help us orient in the right direction. But I think it is the earliest possible hour in the morning for the journey that voice assistants are on to get to goals in diversity, equity, and inclusion on voice. We have to do a lot about changing the voice. It's super great that you can say, Alexa, change your voice, and she's a male, but the AI is still called Alexa. So what does that signal to young girls who learn that, oh, I bark at this thing called Alexa to, set the table or clean up my room. So we have to think a lot about that. We also have to think about how different experiences might be necessary within the same skill, right? And I'm totally out on a speculative limb here, but Alexa is very helpful now at helping you find the vaccine and get the vaccine. But we know that there's a lot of different cultural attitudes towards the vaccine, towards the medical establishment, towards seeking care, towards personal responsibility, towards where my zone of privacy ends and the rest of civilization begins. What's Alexa's role in all of that? How does she adjust her answers based on who you are? Should she? So these are ethics questions, these are moral questions, and they're questions of profound public service. Now, we can have an endless debate over whether a private corporation should be making those decisions, but I think that at least an organization that's as responsive to customers as we are, I think that if the demands are loud, we will respond to them. So I sort of have a commitment myself and with my team and with my community to be incredibly vocal about one size does not fit all. This is not inclusive. This does not reflect our voice. And sort of make those demands publicly and loudly with the power of the purse, which is what we really have with a private corporation. So I would encourage everyone to do that.
Perfect. Amanda, and this is maybe I'm trying to connect this conversation to something we spoke about last week, and I assume that a significant part of our audience was here. And last week we talked about, or Marcus Osborne talked about artificial intelligence sort of becoming the front end of healthcare, or the front door. It seems to me with some of the examples that you provided and the the consumer, the patient is interacting with voice. Do you believe that to be the case? Do you think artificial intelligence will become the front door of healthcare for the future?
I actually do. I mean, that's the answer you would expect to somebody
Yeah.
who's currently working many hours a week on doing exactly that. But I honestly do. I think there's so much Alexa can do about the administrative and financial burden of navigating healthcare and navigating access. That's a rich enough field for us to improve the experience of getting care without ever touching the clinical piece at all. Does AI have a role in the clinical setting? Clearly it does. Radiologists will tell you that AIs have been analyzing millions of images for a while now, and how we eliminate bias and how we assess those algorithms for accuracy are open questions, but it's already present, right?
Mhm.
AI is creating guided navigation tools for surgeons to practice surgeries on digital twins before they even open up somebody's spine, right? Great. But I don't think we need to go there on Alexa today. I think there's a ton we can do, even just to eliminate the incredibly friction-filled and difficult experience of finding a doctor in network. AI is great at that. Let me check credentialing databases and let me cross-check against your insurance status and do a real-time eligibility check to get you a doctor in network who has an open appointment, has the specific criteria that you want from your physician, male, female, experienced in care for people of color, whatever it might be, speak Spanish, and let me find that doctor and let me book that appointment for you. That's not clinical, but that is a great use of AI, right?
Absolutely.
So
Yeah.
I think we have a lot of work there that we can do that's really, really valuable.
So Amanda, on the clinical use of AI, I'm going to lump a few comments that I've seen, regarding about the skills that you mentioned. And so people are asking about, can I use voice in pharmacological development, in clinical trials, EHR integration, as you mentioned. For those who are thinking about voice, for those who are thinking about designing in the audience, what is your position today or your experience into what happens when you're making voice a medical device, right? At what point you're like crossing the line? What does it mean from an FDA perspective when voice becomes a medical device? What is the experience so far?
Absolutely. So let's talk a little bit about HIPAA and let's talk a little bit about FDA, specifically Part 11, which applies to the use of tools in clinical trials. And let's talk a little bit about software as a medical device, which is when the FDA regulates things outside clinical trials, but technologies that are used like this. So HIPAA, everybody knows the Health Insurance Portability and Accountability Act of 1996. There's only one P and none of them are for privacy. So HIPAA often doesn't mean what people think it means. It actually says that any two organizations can share data on a patient as long as they have a formal set of agreements in place for how they're going to protect the privacy of that data and how they will report breaches. They do not have to notify the patient that they are sharing that data. That's called the HIPAA Business Associate Agreement. That's what we execute with all healthcare organizations that fit the definition of a covered entity under HIPAA. It is online at the developer console. You can sign a BA with us right there and then exchange PHI using our HIPAA remediated APIs. Not all of Alexa is remediated for HIPAA. We take it feature by feature and we make sure that the data is secure. It's in the part of the cloud that we have remediated for HIPAA, that we have tagged it appropriately. So God forbid, if we had a breach, we would know about it. And so you're going to see a limited set, but it's still the majority of them, of Alexa feature and services that are available on a HIPAA scale as opposed to a regular old scale. Not everything on Alexa is HIPAA protected. You ask her the weather, no HIPAA protections. You say, Alexa, open home care coach. Everything you say after that is protected by our HIPAA framework, regardless of whether it's PHI or not. We don't look at it. We don't say this is PHI, this isn't. We just protect the whole thing as if it may be PHI. So that's our approach under HIPAA. Pretty easy to do. Just have to be willing to sign the BAA. If you are confused about whether you are a covered entity or a business associate, these terms are all defined at HIPAA.gov. So you can easily check it out and figure out who you are, who your client is, and what the HIPAA chain of trust in a BAA has to be. Then let's look at FDA. So FDA Part 11 and CFR Part 11 and several other pieces of the regulation essentially it's complex and there's many details, but it essentially boils down to all data collected in a clinical trial must have an auditable chain of custody for that data. Unfortunately, today, Alexa does not allow third-party audits of its systems. That's not true of all of Amazon. AWS does, and they have several certifications. We're working on it, but today, Alexa cannot be used to collect primary endpoints in a clinical trial because we simply don't have CFR Part 11 compliance. That said, there's a lot that Alexa can do in a clinical trial. She can do everything except collect the primary endpoint. She can collect real-world evidence. She can prompt a participant to do their trial tasks. She can schedule site visits. She can collect other data. So there's a lot of room to maneuver there, but please do not expect Alexa to be a complete virtual trial in a box.
Right.
She's not quite there yet. And then the third is software as a medical device. So right now, Alexa does not meet that certification, and the Echo device certainly does not. So the way we work with those implementations is if you have a piece of software as a medical device, like a diagnostic algorithm, we could put that inside of a skill. If you work with a third-party device that is an FDA-cleared device, like a continuous glucose monitor, for example, or a wireless blood pressure cuff, we would use Alexa to send that data to you. You would analyze it. You're the one making the diagnosis, or your partner is, on whether that is indeed hypertension or indeed hyperglycemia, and you would send that signal back to Alexa. We do not put the software on Alexa to make that determination. That would put her squarely in the software as a medical device bucket. But if you sort of run the algorithm yourself on the care guidelines and ping us back saying, please notify this patient that they should call their coach, that's an ideal use case for Alexa.
Perfect. Thank you, Amanda. We actually have an example. There's a cardiologist out of LA that is sharing with us how they're implementing Alexa to follow up with patients and connect with the electronic medical record. That makes me wonder, Amanda, are you familiar of any clinical studies or research that has shown that the use of a voice improves clinical outcomes or reduces costs or efficiency, anything along those lines?
Yeah, there's a lot of research being done in this area, and there have been some interventions that have shown that things like remote cardiac rehab or pulmonary rehab, when done with a voice assistant as opposed to a weekly call from a coach, is more effective. I can get you the citations after this. I think that's a little bit stacking the deck. Like, who wouldn't want to talk to somebody every day as opposed to once a week, right? What I look for is the meaningful change in the clinical outcome, hopefully, and I don't know what the results are, so I don't want to anticipate, but when our study results are in from the patient activation measure with Christiana Care, we will have definitive results that people who use the Alexa skill as opposed to regular home care were better able to manage their conditions, were more adherent to medications and to their care plan, and visited the ED fewer times and had fewer hospital admissions. That's what I hope the data will find, but we haven't released the results yet, so watch this space. But I think that's going to be the first study, at least that I know of, with Alexa. There may be others. Yeah,
we'll certainly be looking out for that. I think that as we look at clinical outcomes and what comes out of it, I mean, that's certainly quite a few questions around evidence and clinical outcomes and how people can get involved. A couple more technical questions specifically around, if we implement this technology, voice technology, what is I'm going to say the technological burden or the technical burden to organizations that want to use voice? I assume that the question comes around implementation and just capacity, to be able to deal with the technology. What's your take on that?
Yeah, another great question. I'm super passionate about this. I spent 25 years in healthcare before I came to Amazon. Amazon is my first tech company, and it's the first company I've ever worked at that didn't just do healthcare. In fact, just a brief digression, in my first couple of weeks on the job, I got an email. And the email was about a new launch of something on Alexa, and it was about Grammys notifications. So I looked at the email and I was like, oh, so cool. You can check in on your grandmother and see how her health is and what her blood pressure is and how she's doing. No. It was the music Grammys, like the Grammys. But right. But why would I ever get an email at work about the Grammys? So that was my introduction to the idea that Amazon does other things besides healthcare. And they remind me every day. In fact, their main business is not healthcare. It is selling you things on Amazon.com. So a lot of this has to do with the fact that we are using tools that are built for other industries and we are applying them to healthcare. Now, that's a very exciting thing to do because healthcare has a lot of purpose-only built tools. Nobody else uses EHRs, only we do, right? And what does that mean? Are they leveraging the best of other industry learnings? Not really. So it's exciting to be able to build on that huge scaled platform and have those lessons learned from other industries. but it can be hard sometimes. And skill building, just as you just suggested, is exactly one of them. Healthcare organizations, hospitals, health plans don't really have big banks of software developers hanging out ready to work on a new voice project. So how do we fill that gap? Well, we make the developer console really easy to use. Even I can build a skill, is what I say. Or we have a list of agencies that are approved to build Alexa skills that you can have build a skill for you. You still own and control the skill. It's just that they go on the developer console and do the actual programming work. Another way we're trying to remediate this is we are thinking about skills kits, templates. There's about 3 or 4 use cases that we know are pretty broad-based. A daily care plan, a medication reminder, some other easy tools at home. Somebody mentioned symptom checkers in the chat. We don't have that at the moment, but it's something we could evolve to. So how do we make those kits easily available in the form of a template that you can customize yourself, right? Once you plug it into the backend systems. So we think about reusable tools like that. And then we also think about ways to lower friction in the special privacy guardrails that we put up around all of our Hipaa skills require both account linking and voice profile. You set those up initially when you do the skill. It's very important. It identifies you as the person we're releasing PHI to, but is it the world's easiest process? Frankly, no. So how do we make that easier?
Right, perfect. Thank you. Amanda, thank you very much. Before I turn it over to Steve, I want to thank you on behalf of Hillrom. Great discussion.
Thanks so much, Carlos. And thank you, Amanda, so much for joining us, and to everybody who was part of this discussion today. You're going to receive an email with a survey. Please fill that out to provide us with any feedback about today's discussion. If you enjoyed the conversation today, we have another really interesting discussion planned for tomorrow that will be fascinating in completely different ways. Together with the Discovery Partners Institute, we're hosting a conversation with Bob Langer, who's the co-founder of Moderna and about 40 other companies, and just a general kind of luminary in biotechnology. It's at noon Central Time, and you can find more information on the events tab of our website, which is matter.health. So thanks everyone again for joining us, and we will see you next time.
Thanks.